Welcome to the consulting room. Today we are diving into a very important health condition, one that we are all very familiar with. We are going to discuss living with diabetes, prevention, control, and care. I have with me here Dr. Kwabena Owusu Asante. Doctor, please, you're welcome.
Thank you.
And please, I'll give you the chance to introduce yourself to our viewers.
So my name is Kwabena Owusu Asante. I'm a family physician. I deal with lifestyle diseases from the cradle to the grave, and I work at Heart Adventist Hospital in Sign. I'm happy to be here.
Thank you, and we're happy to have you. So before we dive into the main issue, we'll take a short break. Welcome back. Dr. Asante, once again you are welcome.
Thank you.
So today we are going to discuss diabetes. I know it's within your field of expertise. So to start us off, can you briefly explain to us what diabetes is and the different types that we have available?
Okay. So typically diabetes is a symptom where the body is not able to handle water, so it loses a lot of water. In fact, there are two broad categories of diabetes, but usually when we think about diabetes, it's the second one we think about. The first type is when the body is just unable to concentrate urine, and so it produces a lot of dilute urine. It's called diabetes insipidus. That means that tasteless diabetes. The urine that comes is bland and tasteless. Those days people used to test it. And then the one that we typically think about when we talk about diabetes is diabetes mellitus, or sweet diabetes, where the body excretes a lot of water and that water contains a lot of glucose. So diabetes is when the body is unable to adequately manage the blood sugar level. Now everybody has to have some glucose in the blood. When we eat, the body breaks down the food into various nutrients, particularly if it's a carbohydrate, into glucose. Now once the glucose gets into the blood, there's a hormone called insulin that is supposed to move the glucose out of the blood into the organs that need it to work. So into the liver, into the muscles for it to work, so that at every point in time, the glucose in the blood is supposed to be kept within a normal range so that it doesn't stay there. So when a person is unable to control their blood sugar and it goes higher than it should be, that's diabetes mellitus. The reason a person is unable to control their blood sugar, usually there are two broad reasons. I talked about insulin. Insulin is a hormone produced by the pancreas. What it does is that when the blood glucose goes up, it releases the insulin. The insulin packs the blood glucose away from the blood into the muscle, into the organs that need it to work. So when the body, for some reason, whether due to an infection or whatever, is unable to produce the insulin at all, now the blood is going to be rich in glucose, and the body is going to try to dispose of that through the urine. So when there's no insulin at all, it is called type 1 diabetes. Now when the body is able to produce the insulin all right, but the body doesn't respond to the insulin produced, the net result is pretty similar. Again, the glucose stays in the blood, stays there for longer than, unable to go into the target organs, and then you say you have a high blood glucose. So diabetes mellitus is a state where the body's blood glucose is above the normal range.
Okay, thank you very much. So my follow-up question, what are the commonest symptoms that you see in people with diabetes?
Right, so just following from where we are, so now there's so much glucose in the blood, and as the glucose is high in the blood going through the blood vessels, it has a tendency to damage the blood vessels. So the body tries to get rid of that glucose. Now, the way the body tries to get rid of that glucose is by trying to pass it out through the urine, through the kidneys. And so when the kidneys take out that glucose and try to send it out of the body, it goes with, it draws water along with it, so that the person passes a lot of urine. So when the person urinates a lot, that's one of the symptoms that we see with diabetes. Now, because the person is urinating a lot, it means that they are becoming dehydrated, they are losing water. So the body tries to get the person to replace that water that is lost by causing the person to be very thirsty, to drink a lot of water to replace what they have lost. So in addition to urinating a lot, such a person will also be drinking a lot of water, be very thirsty. So thirsty sometimes that they have just finished drinking water, but their tummies are full, but they still feel thirsty. And then when the glucose stays in the blood, it doesn't reach the organs that need it to work. So the organs that need the glucose to work will still send a message to the brain that we lack glucose, get us some glucose. And so the brain will interpret that as we are still hungry, get us some food. And so such a person would have a very abnormally healthy appetite. The person will eat a lot. So they drink a lot of water, they get hungry easily and eat a lot, and they urinate a lot. But as they eat a lot and the glucose goes up, that goes into the blood, the body tries to discard it, urinating a lot. Now the body realizes that the organs that need energy to work are not getting energy. So what are we to do? Then let's try and harvest some of our fats, some of our protein stores to get energy to the organs. And so you have the person now losing fat, losing weight. So they lose weight. They can lose weight very dramatically. So the 4 key things that you see are they are eating a lot, but they are losing weight. They are drinking a lot of water, they are urinating a lot. And then at some point, that because that urine is rich in glucose, you can find ants gathering around the urine. Or for those who taste their urine, they can come to find that no, their urine tastes sweeter than usual. So these are the 4 main things that would prompt a person that something could be wrong.
Okay. So now, who is at the most risk of developing diabetes?
Right. So for the type 1, I said the person doesn't produce insulin at all. Usually it's people who have had some kind of infection or something. But the type 2, which is the most common, typically glucose, the body takes what it needs from the food, and then the person uses what has been taken out, and then it's in balance. But whoever is unable to shift out the glucose into the organs that need it, and certain things are known to predispose a person to not being able to use the glucose as they should. One of them is obesity. When the fat stores of the person build up, when the person is obese, they begin to get insulin resistant. Again, when people take more carbohydrates or take in more calories than they actually need, over time, this can also predispose them to getting diabetes. And then again, just like other lifestyle diseases, so intake too much or more than needed. Again, when the output is also less than it, so for people who are sedentary, who accumulate the energy but don't use it, over time it begins to get to a place where the system is no longer responsive to the insulin that comes. So these are some of the risk factors. Again, sometimes we talk about family history. Now, it is true that people whose family members, whose parents, close relatives have had diabetes, especially the type 2, are likely to also have it. But very often it is a combination of the fact that, yes, there could be a genetic factor, but also families tend to have typically similar lifestyles, eat the same kinds of things, have similar exercise or work profile, and so that can also be a risk factor for diabetes. Alcohol intake, risk factor for diabetes.
Okay. So, but are there people who are born with it?
Right. So for the type 1, you could have a few people who are born with it. For the type 2, most people are born with the predisposition. That means that they have the tendency to be able to get it. In the past, type 2 diabetes used to be called adult onset diabetes because it was thought that it was only adults who would get the type 2 diabetes. But now increasingly we realize that because many of the children are adopting the habits and lifestyles which were adult characteristics of the past. Now the obesity is happening in children. Now the sedentary lifestyle, in those days, every child will be playing ampere and football and also and skipping and all that. Now they are also sitting more of the time. And so as the age of the wrong choices goes down, the age at which the type 2 diabetes is being diagnosed is also going down.
Okay. So please, are there specific foods and habits that people should avoid to reduce their risk?
Okay. So typically when people hear diabetes, people immediately associate it with sugar disease. And so there are people who come to the hospital, they will do the diagnosis, say, okay, your blood sugar is up. And the person tells you, I don't even eat sugar. So the myth is that it is about eating sugar, but it is about eating anything that has carbohydrates. The body breaks it down. The final form that it will use, the body can use, is glucose. And so it is not just about sugar, but it is about any carbohydrate that we eat in excess. Now there are different forms in which the body takes carbohydrates. There are what are called the simple carbohydrates, the refined carbohydrates. Those ones, immediately they go into the body in a short time, the glucose is released. So that's where your sugars, your drinks and other things will fall within. But what are called the complex carbohydrates are carbohydrates that are combined with fiber. And so I'll give you a typical example. When you take fruits, many fruits contain simple sugars. But because they have fiber as well, they are not so likely to spike the blood sugar as much as the processed and refined ones would do. I mean, sugarcane is sugar, pure sugar. But the amount of sugarcane that a person will have to consume to be able to get a spoon of sugar, you would have consumed so much fiber that it doesn't release into the system to cause a sugar spike. So when we talk about foods to avoid, the processed foods, the processed sugars should as much as possible be avoided. In practical terms, that means that things like the refined rices, things like a lot of the pastries, there's whole grain wheat. But for most commercial pastries, they will not be made with whole grain wheat, they will be made with refined wheat. And so most of the fiber has been taken out. And when that happens, they are more likely to put the body into a state where it can respond to the insulin. And then, again, saturated fats, a lot of animal fats, saturated fats, polyunsaturated fats, those also put pressure on the body to not be able to manage the glucose well enough. And then you also ask about other lifestyle choices. Sedentariness, sitting a lot, staying at one place a lot, not exercising. The more we exercise, the more we use the glucose, the more the body gets efficient at using it. The more we stay still at one place, the more it accumulates into the system. So not exercising, not being physically active also predisposes us to have diabetes. And then if you do not sleep enough, so sleep comes in again. It is known that when you deprive yourself of adequate sleep for even as short as 3 days, the way the body is able to manage glucose begins to change. And so it's important that for a person seeking to prevent diabetes, the 6 to 8 hours per night of adequate sleep should be a factor that should be considered.
Okay.
And then even for things that are quite healthy, like fruits, typically it is very much better to take the fruit itself than even a pure fruit juice. This is the reason. If you take a fruit like, say, orange or even pineapple, now it's very difficult to sit and eat 3 pineapples at a sitting. Halfway through the first one, your teeth will begin to signal you that take time, you've had enough. Now when you make that into a juice or a puree, you can puree 5 pineapples and drink the juice in one sitting, so that you load the body with more sugar at a sitting. So the recommendation is that take the fruit itself, take the vegetable itself, not the sweetened form, not the pureed form.
I see. Okay, so since we are on the diet, if someone is at risk and the person takes, can the person use diet and exercise to prevent developing the diabetes?
Yes,
Someone who's at risk.
Yes, certainly. Diet, exercise, adequate rest, and stress management. All these play a part in reducing, one, the risk and the rate of progression. And so we talked about in the past, people used to say that if somebody is at risk of diabetes or even has diabetes, don't eat rice, don't eat yam, don't eat cassava. The only thing you can eat is plantain.
Yes.
That is a myth. The truth is that all those things do contain carbohydrates, and carbohydrate is a necessary part of the human diet. Now, the yam, the potatoes, the root vegetables, the root tubers, they usually have the carbohydrate in a complex form. And so they don't often give as much of a spike of glucose as eating, say, a refined rice or refined wheat will do. But what you need to do is reduce the portion and balance it out with more stew, because the stew contains the vegetables, which will give you more filling, make you feel full for longer, and will not spike your blood glucose. So the emphasis should be on the vegetables, the fruits, as a conscious decision at every meal.
Okay. So please, with the food, we are talking about balancing it with the other nutrients, protein, vitamins, but you did say stew. You mentioned stew. What about meat?
Okay.
What should we do? Because there are people that say eating too much meat is not good. There are some that encourage eating a lot of meat. So,
right. So again, in the context of diabetes, meat and animal products, the main finding on them is that some of them contain some saturated fats, and sometimes they cause some inflammation as the body tries to manage it. So moderation is key. Moderation is key. It is known that the better sources of protein are really the legumes and the plant-based ones. Now, if it comes to eggs and meat and fish and so on and so forth, the lean, low-fat options are typically better. But the more that you can go into your beans, legumes, and plant-based proteins, you have a greater chance of reducing your risk for that one. I know there are some information out there that talks about carnivorous diet and all that, but you see, it's a balance. Yes, proteins typically will not increase your blood glucose. Okay. But they also put more pressure on the kidney, on the heart, and they also have their own challenges with the whole metabolic lifestyle. So moderation is key.
Moderation is key. Okay, so please, again, what's the importance of medical screening, routine medical screening in preventing the disease? And is it only for people who are at risk, or people who have relatives who have diabetes, or any person at all can do that? Right.
So I'll take the second part of the question first. The truth is that, considering the reality of today, just by being born and growing up, we cannot consider ourselves at risk. And that mindset is good, because you see, when you don't consider yourself at risk, you feel you can eat anything, sleep anyhow, do anything. But we are all at risk. Now, having accepted that we are all at risk, it means that we all have to start our primary prevention, because it is not only people who have it in their families who can develop it. Now, when the condition begins, the body tries to cope. So for a long time, you might not see these features that I spoke about, you eating a lot, drinking a lot, and so on and so forth. You might not actually notice them. And so it is important that even when and whilst you have not yet had any symptoms, from time to time, just check. Blood glucose usually is just by a finger prick test, and then you can tell where you are. There are more sophisticated tests, of course, that would enable us to know not just what your blood glucose is this morning, but what it has been in the past 3 months. You can test your urine, which is also non-invasive. All these are screening tests for the person who hasn't had any symptoms yet. Because if it is picked up at a time when the blood glucose hasn't gotten too high, and the body is already doing a good job of coping, that person will benefit the most by the right lifestyle choices.
Okay. So now let's think of the people who are living with diabetes. Like, what are some of the daily challenges they face?
Right. So for every long-term or chronic illness, I think there's first and foremost the mental burden. I mean, waking up every morning and knowing that even if I feel well, I'm still sick. It is a mental burden. And I believe that at this point, caregivers, family, loved ones can provide an invaluable support. So that is one. And then, obviously, depending on what kind of treatment they are on, even if it is just diet modification or lifestyle modification, sometimes it interferes with their daily life routine. They have to travel, they have to, I mean, it takes effort and discipline. And then apart from that, because when the blood sugar goes up, there's glucose in the blood. Just as when they urinate and ants sense the glucose, they like to come where the urine is. Bacteria and other germs also like the blood that has a lot of glucose in it, so they are more susceptible to a lot of infections. They get infections, and those infections are likely to get more severe if not managed adequately. And then again, the fact that from time to time you need to be tested, because the person who is diagnosed has to be tested more frequently than the person who is just screening. So probably more needle pricks, more hospital visits. Those are all some kind of a burden on the person who has been diagnosed. But I want to end that with a message of hope. The fact that you have been diagnosed is good news, even though it doesn't sound like it. Because time in the past was when the first sign that somebody would even have that they have diabetes is when they have collapsed and they are in a coma. So when it is picked up earlier, the options are more. The chances of reversing the situation are much more. And so I would say that if you or a loved one is told that you have diabetes, yes, usually you'll be told what the possible complications are. But that is not a life sentence or a death sentence. That is a message of hope. That if we are able to collaborate to help this person, they can have a good quality of life. They can slow the progression and in many cases even reverse the insulin resistance that the body has.
Okay. So there is this idea out there that people who are living with diabetes are supposed to always have something sugary around them or on them. Is that a good practice?
Okay, so like many myths, it comes out of incomplete understanding of a truth.
Okay.
So when somebody has diabetes, because the longer the blood glucose stays high, the riskier it is for the person, the more likely it is that it will damage this person's blood vessels. And if the blood vessels going to the eye are damaged, that means this person is probably going to lose their eyesight. If the blood vessels going into the kidneys are damaged, it means that this person is probably going to lose their kidney function. If the blood vessels going into the legs are affected, this person may end up losing their legs. So one of the pillars of treatment is to intervene and bring the blood glucose to within normal levels. Now there are different ways of doing that. The diet, exercise, in fact the first step for everybody should be better lifestyle modification.
Okay.
In fact, in every treatment guideline around the world, the first step is lifestyle modification. Now, unfortunately, discipline is hard. And so many people would rather wish for a shortcut so they can continue living as they have lived. But if many people would adhere to the lifestyle modification, the need for medication and the extent of medication would be much lowered. Now, when it comes to the medications, there are some medications that work by making the body more sensitive to the insulin you're already producing. And then there are some also that work by actually getting the body to release more insulin to reduce the blood sugar. Now, those that work by releasing more insulin, they usually can reduce the blood sugar from high to normal, and sometimes even to lower than normal. Okay. And when it goes lower than normal, which is what we call hypoglycemia, that one can send the person into coma, can kill the person. Yeah. And so if the person is taking some medication that stimulates the release of insulin. That is likely to push the blood glucose lower than it should be. Those are the people who will be counseled to have something with simple sugars that are quickly released on them, so that when they begin to feel the symptoms of low blood sugar, you start sweating, your body starts feeling uncomfortable. It is for such people that it will be recommended that if that is what seems to be happening, you take that so that you don't go into a low blood sugar, because the brain can only use glucose. If the brain is starved of glucose, this person will go into a coma. So it is not everybody who has diabetes who has to have some sweets on them. Okay. If you don't know about the medications you are taking, talk to your physician, talk to your pharmacist, and know whether what you are taking carries that risk.
Okay, thank you very much. So Dr. Asante, another thing, how does stress, sleep, and then emotional health affect blood sugar control, especially for the young people?
All right. So let me start with stress. Stress is the body perceiving that there's a situation that calls for additional resources, basically. And so, if while we are here, an elephant comes running in here, clearly our body will determine that whether we are going to run away or fight that elephant or lion or whatever, we need more glucose in our system. So in every situation that the body interprets as stressful, the body is going to release hormones that will release more glucose into the system. There's a hormone called cortisol, that's a stress hormone. So that whether the stress is emotional, psychological, or physical, even for the person without diabetes, in a moment of stress, if you check that person's blood sugar, it could be high. So if the person already has a difficulty managing their blood glucose, and there is stress as well, that stress is going to keep the blood sugar high and make it more difficult for the person to manage that blood glucose. And so stress relief, stress management, stress containment is a very important aspect of blood glucose control. Now, some of those strategies for the stress containment include rest, disconnecting from the source of the stress. So if the person is unable to disconnect from the source of the stress, so you have somebody whose blood glucose had been well controlled, but the person goes through a stressful situation and that control is compromised. And so even if you don't have diabetes, manage your stress level. It's very important. Don't be the source of somebody's stress, also very important. You need to sleep enough. When they are not sleeping enough, the body interprets that automatically as stress. Okay. Because the body knows that if times were good, you would be resting 7-8 hours a night. So each time you go into a sleep deficit, you don't get enough sleep, the body interprets that as stress. And so the blood glucose will go up, whether you have diabetes or not. And when it persists over time, that higher blood glucose becomes your new normal. And so stress, sleep, rest, they all have an impact on the development and progress of diabetes.
What about emotional health? There's a lot of heartbreaks going on among the youth.
So emotional health, emotional stress, emotional health usually contributes in the form of stress. And if you're in a situation that is always increasing your stress level, you need to deal with it. So anything, whether it is from work, from relationships, that is consistently stressful, you need to take a step back and see how you can reimagine that to reduce your stress level. Now, on the counter side of stress, it is also known that positive, loving connections and relationships, both interpersonal, familial, and even studies have shown that those who have a certain trust in a higher power, in this sense, a trust in God, it helps to reduce stress and anxiety. And because of that, it has a positive influence on blood glucose control.
Okay. Thank you very much, Dr. Asante. We'll take a short break, and after that, we'll come back and continue with where we left off. Welcome back. And the topic for discussion is living with diabetes, prevention, control, and care. Dr. Santi, thank you once again. So to continue with our discussion, what role does the family and even the community provide or play in diabetes control and care?
So the family, the community can be a very important helpful factor when it comes to diabetes. Before the break, we were talking about stress. We know that good, healthy community life can be a very empowering source of stress reduction. People who have good, loving communities, laugh together, play together, have joy together, such people are better able to manage their stress levels. Again, when the family is supportive in helping the person to initiate and implement the positive lifestyle activities, it can also help in the management and control of the diabetes. Because sometimes, for something like exercise, if you are in an exercising community, if you have people who you go play football with, dance, whatever it is together, it helps you to maintain the discipline. It helps you to make it a part of your life. If you have a community where you laugh together, where when you have a problem, you don't have to let the problem weigh on you alone, but you get to talk it over with people. All these are factors that in the community can help reduce the incidence and the progression of the disease. If you are in, again, a community that is health conscious, or if there are people in your circle of influence who know of your condition, they can also help you, remind you, have you taken your medicine? Have you gone for your testing? And all these are things that help in keeping a good balance when it comes to managing the condition.
So we should be encouraging people to attend the church's Keep Fit program.
Definitely.
Okay, so please, what are some of the key lifestyle choices that can help prevent type 2 diabetes?
So, if you're a 7-day Adventist, you have a lot of them: new starts, celebrations, creation, and so on and so forth. I think all of these are very good summaries of what we need to do to reduce our risk of diabetes, and even if you have it, to improve your chances of not deteriorating or even reversing it. So nutrition we have spoken about. It was Hippocrates who said that if you don't learn to make your food your medicine, one day your medicine will become your food. So make conscious efforts that whatever that you are eating for health. When it comes to exercise, be conscious and intentional about it. Sometimes we say we don't have time, work and so on and so forth, but if you don't make time to preserve our health, illness will make time to keep us down. And so it is important. Water. Drink a lot of water. Water helps flush the system. Water helps keep the body in equilibrium. And then you talk about exposure to sunlight and air. The studies have shown that outdoor lifestyle helps a lot also for the body to cope with the predisposition to metabolic diseases. And then trusting in God. It is interesting that in the past, it appeared to be just the church people who were saying that, when you trust in God, it appeared to be fictional. But now, studies have actually been done, and people who have a belief, a trust in God, and belong to a community of faith, and by belong, I mean participate, not just get to church at 11, be gone at 12, but actually participate in that community of faith. Studies have shown that such people, even when they have complications of severe disease, their recovery chances and rates are much better. So be involved with people, be involved in the society, be involved with the church. And then temperance. What is not helpful, avoid. What is helpful, use with wisdom and good judgment.
Okay. So we talked about the symptoms of diabetes. But my question is, are there some early warning signs that you can look out for before you even get the diabetes?
Yes, so these signs can be quite subtle, and it takes the alerts to point it out. Some people can feel unnecessarily tired. I mean, tiredness that doesn't match with how much work they have put in. Can feel drowsy in the course of the day, which is disproportionate to how much. I mean, we know that if you've had a very busy day, yes, you can be tired at the end of the day into the next day. But if the level of tiredness doesn't really match, it may be a warning sign. Some people will begin to have blurred vision. I mean, the way that they see things seems to have changed. That may be a warning sign. Some people would begin to have skin infections, boils, uncharacteristically. That could also be another subtle sign. Typically, when you eat in the morning, you know that you don't really get hungry again till maybe about 3, 4. But now you've eaten well, but within a shorter time, it seems you are hungry again. You know, these are all quite subtle signs that could be the body giving you a signal before things have really gone bad.
Okay. So, once someone is diagnosed with diabetes, what are some of the most effective ways to manage their blood sugar?
So, if it is type 1, which as I said, the body is not producing insulin at all, then for that person, the person must receive insulin from outside.
Okay.
But if it is about type 2, and there are different versions of it, but so long as the person is unable to manage their sugar well, even though they have insulin, weight optimization. When the person is above the weight expected for their height, as their weight comes closer to the optimal, their blood glucose control tends to improve. Exercise. As the person consciously adds exercise to the routine, and let the exercise as much as possible be something that you enjoy. Some will prefer to skip, some will prefer to dance, some will prefer to play badminton, football, whatever, but consciously put exercise into the mix. And then we've talked about the dietary choices already. Things that are stressful, learn to manage that stress. Now, when all these things have been brought on board, there's a place also for medications. Now, I want to say this and say it over and over again. Medication to reduce the blood sugar is not a license to continue living your life as you have lived, because diabetes is progressive, if not checked. So that if your lifestyle choices have brought you to the place where you need medication, take the medication and let the lifestyle choices change. Otherwise, the level of medication that you need at the beginning, a time will come, it will no longer be able to match up. So lifestyle choices, lifestyle choices, lifestyle choices. And then if your medication is prescribed for you, adhere to your medication regimen. If there's something you don't understand, if you feel that you're experiencing something that could even be from the medication, talk to your doctor again. A lot of times what happens is that people start taking the medication, and when they feel they've gotten better, they stop. Chances are that by the time that you find them again, the blood sugar has gotten out of control entirely.
Okay. So, for someone who is living with diabetes or someone who has been diagnosed, how important is the regular checkups or monitoring that they do, and how often should it be done? And with the focus of preventing complications, how important is regular medical checkup for such people?
Yes, it is absolutely important. Sorry. So it is absolutely important. The high blood sugar is a problem, but the bigger problem is the complications it can lead to. Affect the eye, affect the blood vessels, lead to amputations, lead to blindness, lead to heart diseases, and so on and so forth. And so for a person who has been diagnosed with diabetes, it is important that the person is frequently monitored. In fact, in the past, most practitioners would recommend that you come to the hospital maybe at least once a month, but now the recommendation is even that the person himself or herself be taught how to self-check at home, should have the device at home, so that they can keep an eye on their day-to-day blood glucose. And then because we anticipate that certain complications can arise, complications to the eye, to the kidneys and other structures, it is important that at the scheduled review days, sometimes because it's a bit stressful going to the hospital, people want to say, oh, I know the prescription, so you just go to a pharmacy and then keep buying. But that is not very safe. It is important that from time to time you are reviewed, an assessment is made of your overall system, the kidney function, your eyes, and so on and so forth. And then when the medication needs to be varied, altered, changed, or modified, the doctor can help you to take that decision. But now the guidance is that it is not just the doctor managing your diabetes, it's a shared responsibility. All of us together helping the patient, and the patient at the center of the care.
Okay. So, can you take us through some of the complications in diabetes and how they can be avoided?
Right. So, as the blood contains so much glucose, it irritates the blood vessels. It causes inflammation in the blood vessels. And the blood vessels carry blood to every part of the body. So there are big vessels that go to the big structures. There are small vessels that go to the tiny structures. Now, when these blood vessels get injured, it means that the organ to which they are sending blood cannot function well. And so if there's a blood vessel going to the eye and they are injured or damaged, it means that the person's eyesight is going to be compromised. So we can have blindness or impaired vision. And then that high blood sugar can also lead to other eye conditions like cataracts, where you have a white disc on the eye, so to speak. And then if it is vessels to the lower limbs, it means that the lower limbs, the legs, the feet are not going to get blood as they should. And so if somebody has a cut, an injury to the lower limbs, and the blood circulation is not very good and is not well managed, this person can have what is called gangrene, or death of the cells of the lower limb, which can lead to amputation. Such people can be at risk for very severe infections, because when the blood sugar is high, the bacteria are happy. And so these are also the risks. The kidneys can get damaged if the vessels going to the kidney are affected. The vessels going to the heart can get damaged, and so it can lead to heart attacks and cardiovascular disease. It can lead to the vessels going to the brain getting damaged and increasing the risk for the person having strokes and other conditions. So all of these are things that can happen when the blood sugar is not well controlled. And so the reverse is also true, that as the blood sugar is improved, as the blood glucose control is improved, all these risks are reduced. And so it is very crucial that the blood glucose monitoring be done frequently and timeously. And the interventions that will bring the blood glucose down, especially the lifestyle, but also the medications, should be used hand in hand.
Okay. So how can family members and caregivers give a proper support to someone living with diabetes? What's the role for family members and caregivers in managing diabetes?
So support is very important. Emotional support, psychological support is very important. And then practically, so perhaps the person has had some dietary modifications because of the diabetes. If the family comes along, it is helpful. Psychologically, sometimes it's difficult when the whole family is eating A and person B who has diabetes is eating something else. Sometimes the person can feel stigmatized or discouraged. But when the whole family comes on board to support, knowing that they are also protecting their own health, it helps. When the family supports the person physically, financially, economically, emotionally, to go for their reviews, to follow up their medication, to adhere to their medication, all these are factors that can help in the management of the person. And when it comes to the caregivers, I think sometimes this is where we in the hospital setting also have to do a bit better. Sometimes we seem to manage our patients from the point of, I'm the expert, this is right, take it or leave it. But I think that if we can be more empathetic, take more time to engage with our clients, explain to them what they don't get. Even listen to their misconceptions and give them additional information. It helps. You see, sometimes there are people who don't have so much right information. What they have is the time to make the person feel heard. And so sometimes they will lead them to do things that they should not be doing simply because they were empathetic and listened to them. I think that for us in the care sector too, we need to make our clients feel heard, feel empowered to take responsibility for their choices.
Okay. So there are times from clinical practice, there are times a patient will come to the hospital and they'll be like, the doctor gave me this medicine, but when I take it, I feel dizzy or I feel this, and so I've stopped taking it. What do you have to say on that?
Yes, I think it follows from the previous point that, and I've encountered many like that. Sometimes out of goodwill, you knew that this would help the patient, and they come and they tell you that they have stopped. You know it's going to harm them. So out of that goodwill and love, there's a tendency to be a bit unsympathetic and harsh. But that is the very worst thing that we can do. You see, whenever people have been taking the wrong choice, it is often because of information they had at the time. And so what we need to do is to engage, get that information that we consider wrong, and give the alternatives. At the end of the day, yes, the patient is still responsible for their own health, but we are responsible for giving them the best of choices for them to select from. And I think that we should keep that door always open that, oh, if you go, you experience something you're not sure about, get back to us. Let's talk again. Sometimes it could even be that it is not from what you think it is. For instance, for people who have had quite high blood glucose, when treatment starts, just for the fact that the blood glucose is dropping steeply initially, they can have some signs that may be disconcerting. But when we reinforce to them that, oh, this is just an expected part of the treatment, and after a while it will go away, at least it will help them to retain confidence in the treatment plan.
Okay. So there are a lot of myths surrounding diabetes. There are people who believe that it has a spiritual backing. There are some who think herbal medicine is the way to go. There are so many stories surrounding it. And I believe from your field and your years of experience, you've encountered so many myths and misconceptions. So can you share some with us and also clarify and educate us on the reality?
I think I've mentioned a few in the course of the time, but let me add a few. So one of the myths that is very common is that it comes from eating sugar.
Yes.
So once I'm not eating sugar, I don't need to take my medications. That's a complete myth. It's completely wrong. You may not be taking sugar, but from other sources, your body is exposed to glucose. And so you have to go ahead and carry out your total treatment plan. And then there are those who also feel that, oh yes, at first I was urinating a lot, but now I'm not, so I'm fine. On the day when I feel I'm urinating, I take my medicine. That is also a myth, that once you feel fine, you are fine. Because when the blood glucose begins to go up, it goes beyond a certain level before it comes to play as sweet urine and all that. So the blood glucose could be above the normal, but your urine could still be not sugary. You could still have not urinating as much as before. It is the blood glucose that tells you the blood glucose. Without testing, you can never be sure. And then there's another one that I've encountered that if you take, as for herbal or natural products, they are completely safe. The truth is that many of the medications that we call orthodox, they are basically herbs with the active ingredient taken out. So the truth is that even if it is herbal, even if it is natural, it doesn't mean it is harmless. And then the last myth that I want to touch on is that once I'm taking my medicine, I can live my life anyhow. Medicine is to give me freedom to live my life anyhow. No. The medicine is to support you to make the right lifestyle choices so that together you improve your outcome.
Okay. So, please, for someone who is newly diagnosed with diabetes and is overwhelmed, what advice can you give to such a person?
So that new diagnosis, yes, it's big news, it's difficult news. And at the beginning, like every other bad news, it comes with a blow. But after the initial shock, when you have been diagnosed at the point where you are not lying down in a coma, then that is good news. Because now we can work together to make sure that you have a long, successful, healthy life, either with the condition not progressing or even reversing. You asked about some of the myths about it being spiritual and all that. Do your part, pray to God. Let Him handle the spiritual and do what is within your power to do. And don't isolate yourself. Don't stigmatize yourself. The caregiver family, they are all there to support you to get better and make progress. It is not an immediate death sentence, but it is a step for hope to make things better. So that is the point to begin to question, what are the things that we can do better going forward?
Okay. So please, I think our time is almost up, but how does the future of diabetic care or diabetes care look like? Are there any new treatments, interventions, technology, anything at all that is out there to make it better?
Right, so the field of learning goes on, and the treatment options, as we learn more about the disease, we learn more about ways of tackling the disease. So there are many more things that are coming up. Even the character and caliber of medications, year in, year out, new ones are coming out. But I think the most important thing that has come out recently is about the power of lifestyle choices to make things better. The more we learn, the more we come back to the basics. And so, yes, other options, treatment options, medicines that work differently or better may come. But for all of these things, let us return to the positive lifestyle choices. Let us make them our lifestyle and habits. And once we do that, whether for prevention or for management, whatever else comes from the field of treatment just comes to add on to what we already have. There are treatments, some surgeries, some gene therapies and all that, but these are all new information that is evolving. But the one thing that never changes is that the more we learn, the more we know that the basics work.
Okay. So, I want to ask a question. How dangerous or how bad is diabetes? With everything that you've said, what's the message you want people to get about diabetes?
So diabetes is dangerous, especially without intervention. Left alone, it is a journey that will arrive in trouble. But the good news is that once we know, there are many options for improving the outcome so that we don't get there. So yes, if you leave it alone, then it has what is called a natural progression. Eventually it will affect your eyes, it will affect kidneys, it will affect the heart, it will affect erectile dysfunction, it will affect everything. But the good news is that when you know before the complications have set in, to be forewarned is to be forearmed. So don't stay in ignorance. Find out. And when you find out, do the needful.
Any final words?
Yes, so my final word is that diabetes is a serious business, but there's cause for hope. Maybe in your family, you may even have it yourself. Make the right lifestyle choices and make them your daily habits. And then, if you have been put on medication, be faithful to your treatment course. But take responsibility for your health. That's the last thing that I would say.
Okay. Thank you very much, Dr. Asante, for such an insight into this topic. Diabetes is one of the most common conditions we see in our society, but there's also a lot of misconceptions and poor education amongst even the people living with it. And so we are very grateful for your time today.
Welcome.
Dear viewers, today we've learned that diabetes is a serious but manageable condition. Understanding the condition, knowing the risk factors, the early warning signs can save your life. Lifestyle choices like healthy eating, regular exercise, and regular checkups are very important in preventing and managing your condition. And so let's take charge of our health, and let's remember that diabetes doesn't define you, and that with right care you can live a healthy and normal life. Thank you very much for tuning in. See you again next week.